Hello everyone, my name is Winita Tarmansyah from 11 Miawan. Now I want to tell you guys about kidney failure. Kidney failure, also called end-stage renal disease, is the last stage of chronic kidney disease. When your kidneys fail, it means they have stopped working well enough for you to survive without dialysis or a kidney transplant. The first topic is what causes kidney failure. In most cases, kidney failure is caused by other health problems that have done permanent damage to your kidneys little by little over time. When your kidneys are damaged, they may not work as well as they should. If the damage to your kidneys continues to get worse and your kidneys are less and less able to do their job, you have chronic kidney disease. Kidney failure is the last stage of chronic kidney disease. This is why kidney failure is also called end-stage renal disease or ESRD for short. Diabetes is the most common cause of ESRD. High blood pressure is the second most common cause of ESRD. Other problems that can cause kidney failure include autoimmune disease such as lupus and IgA nephropathy, genetic disease such as polycystic kidney disease. The third one is nephrotic syndrome, and the last one is urinary tract problems. Sometimes the kidneys can stop working very suddenly. This type of kidney failure is called acute kidney injury or acute renal failure. Common causes of acute renal failure include heart attack, illegal drug use and drug abuse, not enough blood flowing to the kidneys, urinary tract problems. This type of kidney failures is not always permanent. Your kidneys may go back to normal or almost normal with treatment and if you do not have other serious health problems. Having one of the health problems that can lead to kidney failure does not mean that you will definitely have kidney failure. Living a healthy lifestyle and working with your doctor to control these health problems can help your kidneys work for as long as possible. What are the symptoms of kidney failure? In the left side, you may notice one or more of the following symptoms if your kidneys are beginning to fail. The first one is itching, muscle cramps, nausea and vomiting, not feeling hungry, swelling in your feet and ankles, too much urine or not enough urine, trouble catching your breath, trouble sleeping. And in the right side, if your kidneys stop working suddenly, you may notice one or more of the following symptoms. The first one is abdominal pain, back pain, diarrhea, fever, nosebleeds, rash, and vomiting. The next one is, what are the treatment options for kidney failure? If we have kidney failure, we will need dialysis or a kidney transplant to life. There is no cure for ESRD, but many people live long lives while on dialysis or having a kidney transplant. There are just a few options for treating kidney failure, including kidney transplant and several types of dialysis. Your doctor can help you figure out which treatment is best for you. Number 4 is dialysis. There are two types of dialysis. There are hemodialysis and peritoneal dialysis. Hemodialysis. In hemodialysis, an artificial kidney is used to remove waste and extra chemicals and fluid from your blood. To get your blood into the artificial kidney, the doctors need to make an access into your blood vessels. This is done by minor surgery to your arms or leg. Sometimes an access is made by joining an artery to vein under your skin to make a bigger blood vessels called a fistula. However, if your blood vessels are not adequate for a fistula, the doctor may use a soft plastic tube to join an artery and a vein under your skin. This is called a graft. Occasionally, an access is made by means of a narrow plastic tube called a catheter, which is inserted into a large vein into your neck. This type of access may be temporary, but is sometimes used for long-term treatment. How long do the hemodialysis treatments last? The time needed for your dialysis depends on how well your kidneys work, how much fluid weight you gain between treatments, how much waste you have in your body, how big you are, and the type of artificial kidney used. Usually, each hemodialysis treatment lasts about 4 hours and is done 3 times per week. A type of hemodialysis called high flux dialysis may take less time. You can speak to your doctor to see if this is an appropriate treatment for you. The second one is peritoneal dialysis. In this type, your blood is clean inside your body. The doctor will do surgery to place a plastic tube called a catheter into your abdomen to make an access. During the treatment, your abdominal area, called the peritoneal cavity, is slowly filled with the dialysate through the catheter. The blood stays in the arteries and veins that line your peritoneal cavity. Extra fluids and waste products are drawn out of your body and into the dialysate. There are two major kinds of peritoneal dialysis. There are several kinds of peritoneal disease, but two major ones are continuous ambulatory peritoneal dialysis (CAPD) and automated peritoneal dialysis (APD). CAPD is the one type of peritoneal disease that is done without machines. You do this yourself, usually 4 or 5 times a day at home and at work. You put a bag of dialysate into your peritoneal cavity through the catheter. The dialysate stays there for about 4 or 5 hours before it is drained back into the bag and thrown away. This is called an exchange. You use a new bag of dialysate each time you do an exchange. While the dialysate in your peritoneal cavity, you can go about your usual activities at work, at school, or at home. The second one is APD. APD usually is done at home using a special machine called a cycler. This is similar to CAPD except that a number of cycles occur. Each cycle usually lasts 1 until half hours and exchanges are done throughout the night when you sleep. How long can you live on dialysis? If your kidneys have failed, you will need to have dialysis treatments for your whole life unless you are able to get a kidney transplant. Life expectancy on dialysis can vary depending on your other medical conditions and how well you follow your treatment plan. Average life expectancy on dialysis is 5 until 10 years. However, many patients have lived well on dialysis for 20 or even 30 years. Talk to your healthcare team about how to take care of yourself and stay healthy on dialysis. Number 5 is percentage of Indonesian population suffering from kidney failure. So as you guys can see, there are projected number of people suffering from a chronic kidney disease in Indonesia from 2017 to 2020. In 2017, there are 10.55 million people. In 2020, 11.66 million people. In 2024, they may have a prediction 12.55 million people suffering from kidney in Indonesia. So here are some tips to help keep your kidneys healthy. The first one is keep active and fit. Number 2, control your blood sugar. Number 3, monitor blood pressure. Number 4, monitor weight and eat a healthy diet. Number 5, drink plenty of fluids. Number 6, don't smoke. Number 7, be aware of the amount of OTC pills you take. Number 8, have your kidney function tested if you are at high risk. I think that's all that I can tell to you guys. Thank you.